types of use. These are all the words. Dual diagnosis means a person who's depressed and drinks or uses drugs or perks or OxyContin, whatever. Pick a drug. And why do they use it? Because they just feel bad. They want to feel different. So maybe they are medicating that depression. That's not even current anymore. It's all outdated. It's complex care. A person needs more than one treatment. These are those stats from Senator Tolman. I mean, you're looking at these are just mind-blowing. We're talking Massachusetts. This isn't even going national. Is it a disease? Well, to me it is, and it's lifelong. Once you're diagnosed, and it's the only disease that's self-diagnosis, the only disease, the person has to say, I have a disease. Because every time a doctor, nurse practitioner, or a PA says to you, you know, you're going to die. You got this and you keep. What happens when you're on the other end? No, I'm not. I'm fine. So the denial becomes more intense. I had one doctor say to a patient, you know, if you keep this up, you're going to die. I said, doctor, come here. Could you stop telling him he's going to die? This is his 26th admission, and you're losing credibility, so just stop. The approach really is to approach the person, and I stole this question from the Irish Immigration Center downtown Boston. The question they ask a person that walks through the door, and they're typical Irish, they service anybody. Anyone can walk in there and get help. And the question they ask everyone is if you're using, they'll say to you, is this the life you want? That's all they say. They don't get into judgment. They don't say, oh, how'd you family? What's going on? They don't get into, is this the life you want? That's a motivational intervention question. Use it with your kids. Is this what you want? A couple of years ago when I applied for a job, one of the things they said to me, so what do you consider your greatest achievement? Now, you know the drill. You know you're supposed to answer objectives and goals and all that nonsense. And I just looked at them, 7 in the panel, hitting me up, and I said, my greatest achievement is raising 3 drug-free kids. They were stunned. It was not the response that they expected. Someone else asked me, and for all of your resources, you need to know about this group. It's called Learn to Cope. And it's in Google. You can Google it, Learn to Cope, and it's the 2, Learn to Cope. I think it's .com or .org. Those groups are springing up everywhere. They're specifically for families who are dealing with kids who have overdosed, kids who are using. Now with them, with all of this craziness. Now, did my kids use? Absolutely. And there's always a measure of luck when they don't get caught. But I said, just like Sean said, I said to my kids, you got scholarships? Here's where you are. You get arrested? Don't call me. They went, oh my, stop. You'll bail us out, wouldn't you? No. You know what they said? We'll call Dad. And I said, your father will listen to me on this, or I'll kill him. But they knew, and they knew I meant business. And one kid, my oldest daughter's her friend came in and said, Mrs. White, can I ask you a question about, fill in the blank there about certain drugs? I said, sure, sit down. A friend of mine, oh, really? Okay. So I said, so how's your friend doing? So answered all the questions. My oldest daughter said, so that'll teach you to ask my mother a question. But you know what? Be there. And if you don't know the answer, tell your kid, I don't know the answer, but let me find out. I was reading that book, a lot of quotes from Dr. Knight in Boston about if you used. And many of us have. If you're even near my age, or younger, you've used. What do you answer when your kid says, Mom, do you use drugs? Dad, I see you drinking. Read that book tonight, or this week. Make sure you read that, because it has clear responses you can say to your kids when they want to know if you've used. And be honest. And I've said to my kids, yeah, I used a lot. And you know what? I don't want you to make my mistakes. And I want you to have a better life than me. So don't base your life on mine. Those were my responses, and Dr. Knight's saying a lot. Very similar. Read those tonight. For you as a parent. So this, chronic disease, yeah, it's lifelong. I apologize. Am I blocking your view over here? Feelings. This disease causes so many feelings in people. My goodness. So what does it take to make people sort of understand that it is a disease. People can exhibit any of these. I got a call from the medical staff one time. You need to come up here right away. Look where I work. I said, okay, what's going on? And I go up there, and the man has a runny nose, and he's got one tear coming down of his eye. And I said, that's low-level withdrawal. He was on staircasing down, coming off methadone. And I said, how are you feeling? He said, oh, my leg's hurting. He's got bone pain. He's got a runny nose. He's got tears in his eyes. Low-level withdrawal. And I marched up and I said, you can't just judge this man. He's in withdrawal. You have to know what you're looking at. All right. So is your brain changing? Yes. When? Well, there's no timeline on a predictable way to say, if you use for 6 months, your brain's changing. It's all different, especially if they're kids, because the brain isn't fully formed till in the 20s. Sometimes don't you wonder, really, is it ever? But just think about that. Up here, and in that book, it talks about your executive functions. That's up here. You know when you see the pictures of the brain up here, that's what I can do, what's right, what's good, what's bad. You know those choices that you make? You know when you're laughing in church, and there's a little voice that says, stop it, stop it. That's your executive functions. That's the part that isn't fully formed with kids. That's why they're so crazily impulsive and do stuff. And they look for ways to get high, to feel differently, have fun. So their brains are not fully formed. This is a brain neuron. And the thing I teach kids, I teach anybody that will listen, take the word intoxication. Prefixes, suffixes, and roots. Prefix in, ation at the end, process of, toxic. It's toxic. Any drug can be toxic. What does that mean? I make my kids, I make patients, I give patients homework. Look this up, go down the library. I don't know, oh, I can't. Go down the library, you know how to use their computer. Look it up and come back. Opioid dependence, when a person starts using guys, over there on the left, the first thing they will say to us all the time, or to officers, is that first time they got high. Whoa, yeah. That's a surge in your brain chemicals. They will, for the rest of their lives, remember that lovingly. And it's called in the drug world chasing the high. Or chasing it. They don't say chasing the high anymore, it's chasing it. Because they remember that fondly. Remember the 3 ways what you feel? That's very positive. It has that. And the other thing with heroin, with all the opiates, when you use it, you feel a glow. It starts here in the abdomen and it just feels warm and comes out. Some people liken it to an orgasmic feeling. I don't know, it's probably pretty positive, but I'm Irish, so I don't even go there. Now, up here, if you keep moving these lines here, eventually that person using doesn't even feel good anymore. They feel sick, even when they're continuing to use. And it takes a while. It goes beyond age 24. So, but there are other people, the disease can accelerate and happen really fast. So there's no real predictor with this stuff. You want me to stop, Chief? You want me to just 2 minutes and I'll shut up? Okay, relapse. You know, people always say to me, you can go upstairs and give them hell, meaning the patient. And everybody thinks I'm going to go up and yell at patients. I don't. When I go up and see a patient, one of the things I say to them is, welcome back. Because relapse kills people. I'm glad you made it. Now tell me what was happening, what was going on. This heroin, a lot what they say, what I'm reading is, I don't know, tell me if I'm the DEA agent. I'm reading that it's coming from Afghanistan. So the purity, and you heard that this morning, is much different. And we treat in our hospitals anyone 18 and older, and there's a percentage of people in our hospital that are in their 60s using heroin for decades. How? They're using lesser purity, they don't know exactly how to live. When they get this stuff, this is how they overdose. When a person overdoses, one of the things we advocate in Boston is everybody be Narcan trained. Do you all know what Narcan is? Narcan will reverse an overdose. You can get this from Department of Public Health. I believe the entire entire, excuse me, police department of Quincy is Narcan trained. You need to think about this. This is nasal Narcan. Now, I'm not advocating people use drugs. I'm advocating people live. So if you come upon someone who is blue and overdosing, you can administer nasal Narcan. You can be trained in this. It doesn't have to be a medical professional. At the Learn to Cope meetings, one of the things they do is in a second room, they train everybody, families, how to do this. So that in the event of a possible overdose, you can carry it in my purse. You can always be prepared. All right, the reason I put this up there, and you already saw one of the officers show a picture of this, because I ask people, usually we don't have the time, is what kind of feeling does that engender in you when you see that? It's tough to look at. Principles of a treatment, one of the things you really have to examine is your attitude. I grew up in a crazy home. My father was a police officer. Arrest him, get him off the road. My father was an alcoholic. Arrested 5 times. But just think about this. How powerful is denial? You have to look at your own attitude about this. Be flexible. Be flexible, be respectful. I always treat my patients, clients, consumers, guest resident with respect. I ask them how they like to be referred to. You want to be Mr. or how? Who are you? We shake hands. Tell me how I can help you. Is this the life you want? If they say, yeah, I'm okay, I will come back. It's called brief intervention. I will leave you alone, because attitude says, if I think of you as a nail, I'm going to turn into a hammer. It doesn't work. Identify strengths, use therapeutic optimism. You can do this. You can stay abstinent for today. I don't say sober for today. Sober is a lifestyle change. Not using the chemical means you're abstinent for today. Does that make sense to you? It's not clean, it's not dirty. You're just not using, you're abstinent today. If you're changing your life and you're calling your sponsor and you're going to meetings, you take a medication that you're going to take, that's a lifestyle change. This is in 2005, made me crazy. Made me crazy when I saw this on the front of the Herald. Because what they were doing was exploiting people getting methadone. Methadone is treatment. People will say to me all the time, well, isn't it just replacement, one drug for the other? That's exactly what it is. It's replacement therapy for a deranged brain. People get their lives back, they get their kids back, they can hold a job. They do well. And all they did was sensationalize it. One of our doctors wrote a letter to the paper, and they published her letter, but they left off MD, off her name. All right, we use drug screening. Well, my God, and patients say to me all the time, you don't believe me? It's the disease I don't trust, it's not you. So, this is what I show them all the time. Santa will believe it. Santa can tell if you've been bad or good, depending on your drug screen. All right, here's the brain again. These are, I won't get into a lot of it, but this is where parts of the brain. And why treat addiction? I'll actually end here. Why treat this? I have more on Suboxone. You heard a little bit from Sean on Suboxone. There's a whole new body of knowledge on pharmacology to help people in withdrawal. And years ago, when I grew up, it was don't drink and go to meetings. You don't need any of that stuff. And heroin, my God, huh? Who's using that stuff? There's an urban myth out there that the word heroin is for heroic effects. That's not true. There's another urban myth that the word Dolophine, which is the other name for methadone, I don't know if you know that, but the other name is Dolophine. There's an urban myth that it was named after Adolf Hitler. Not true. This is craziness that just sort of erupts on the street. Suboxone is the newest kid on the block. Can it be abused? Can't everything? I've had a patient snort Tylenol, and a counselor said to me, why? Because they could. Don't try to be rational with a crazy disease. There's an irrationality to this. So just think, Suboxone works if it's used correctly, if it's taken correctly. Methadone is treatment. Why do some people take methadone and some take Suboxone? Methadone, some people need the structure of showing up every day. It's different, whatever works for people. So there's those motor vehicle accidents. I won't get into that.